Ozempic has been all over the news and social media. Celebrities and many others have been using it, but of course, they don't admit to it. To properly cover the topic, I asked a board-certified internal medicine physician, Dr. Elizabeth Grand, to help me with this topic. She also happens to be my wife. Hello.
Hi.
We finally convinced Liz to join me for a video. You're welcome. So please show support in the comments below. So Liz, what is Ozempic?
Great question, Dr. Gary. So Ozempic is the brand name for a medicine called semaglutide. It's a once-weekly subcutaneous injectable medication, meaning that the medicine gets injected into the skin in usually the upper arm, the thigh, or the abdomen. And it's primarily used to treat type 2 diabetes. That's what it was FDA approved for initially in 2017. Ozempic or semaglutide belongs to a class of medications called GLP-1 receptor agonists. And GLP-1 is basically a hormone that's produced by the GI tract. And so the GLP-1 receptor agonists essentially work on these GLP-1 receptors. GLP-1 receptors are located throughout the body, but there's three main areas that we'll talk about today. The first is the pancreas, where it leads to the release of insulin. Insulin then promotes the absorption of glucose into tissues to be used for energy or to be used as a form of energy storage. And this ultimately causes a decrease in blood glucose levels. The second is the brain, where it decreases appetite by reducing the feeling of hunger. And the third is the GI tract, where it slows down the movement of food and thus makes us feel more full. In terms of dosing, we generally start with semaglutide at 0.25 milligrams weekly, and it can gradually be increased to a maximum of 2 milligrams as tolerated. The cost without insurance can be up to about $1,200 a month. And there is another form of semaglutide called Wegovy, and this is basically semaglutide in a higher dose. And this is the medication that's actually FDA approved for weight loss, but it is specifically approved for people either with obesity or who are overweight with at least one weight-related condition. These include conditions like high blood pressure, high cholesterol, and heart disease. So what is Ozempic or semaglutide used for? It was initially meant for the treatment of type 2 diabetes to help decrease blood sugar by augmenting the release of insulin. But people found that there was also this impact on weight loss, and it's been studied and it has been shown to reduce weight. But what they've also found is that people generally need to stay on Ozempic in order to maintain the weight loss. In terms of risks or side effects, the most common side effects that we typically see are nausea, vomiting, constipation, sometimes diarrhea. We also see dizziness, increased heart rate, headaches, reflux, even sometimes acute kidney injury, which is thought to be due to dehydration from all of the nausea and the vomiting that Ozempic can induce. It's also not recommended for people who have certain gastrointestinal tract diseases like inflammatory bowel disease, things like Crohn's disease or ulcerative colitis. There's also a black box warning for a specific type of thyroid cancer. This comes from studies that were done in rodent models that showed growth of a specific type of thyroid tumor. Acute pancreatitis, which is a condition where the pancreas becomes quite inflamed, has also been noted in this class of medications. And it's really important to note that pancreatitis can be severe and can be fatal. It's unclear what this mechanism is for this possible complication. It's also unclear whether or not this has any implications for pancreatic cancer in the long run. But regardless, if you have a history of pancreatitis or if you develop pancreatitis while on the medication, you should stop it and you should never take it again.
Significant weight loss with drugs like Ozempic and Wegovy can change the way our faces look. As we've covered in other videos, we have many fat compartments throughout our face, and these compartments are affected by anything that leads to weight loss, such as bariatric surgery, such as just kind of natural weight loss with diet and exercise, and or with drugs like Ozempic and Wegovy. As our weight drops, the fat in our face decreases as well. This could lead to areas appearing more hollow, more gaunt, and also our skin starting to droop. It may be that the faster the weight loss with these medications and the more significant the weight loss, the less the body has an ability to adapt and adjust, and that can lead to more sagging at a faster rate. Now, how are celebrities involved in all of this? Well, the cost of Ozempic is about $1,200 per month for off-label use of Ozempic as a weight loss drug. And that is a major expense for most people, but usually not a major expense for most celebrities. And similar to the lack of transparency when it comes to plastic surgery for celebrities, so too with weight loss, there is a similar lack of transparency. For example, Kim Kardashian had to fit into that Marilyn Monroe dress for the Met Gala. And as many have surmised, including the New York Times, she may have taken Ozempic to drop weight quickly to try to fit into that dress. But remember that the safest way to lose weight is to do so gradually with these medications and with any other method as well. I'm anticipating that the popularity of facial filler, including fat transfer to the face, will increase because of medications such as Ozempic. I also think that the incidence of lifting procedures such as brow lifts and facelifts will increase as well because, as we talked about previously, there's an increased sagging that occurs when the fat in our face declines. And we've been talking a lot about buccal fat removal on this channel and the risks of that procedure. And keep in mind that Ozempic is now introducing additional hollowing of the face. So if someone's had a buccal fat removal, then they go on Ozempic to lose further weight. Now they're going to look even more hollowed out, gaunt, and they may be looking to replace that lost volume. So Liz, is Ozempic a good idea?
So certainly for people who have type 2 diabetes, yes. I like the fact that in general it's not associated with hypoglycemia, which is when the blood sugar drops to a dangerously low level. This can be a very serious issue for people as they're trying to get their blood sugar under control. For people who are obese or are overweight with conditions like high blood pressure, high cholesterol, heart disease, obstructive sleep apnea, I think yes.
So Liz, I've heard that there's like a shortage of Ozempic right now.
Yeah, this is the big problem right now. People who really need this medication are not getting it. People who have type 2 diabetes who have been on this medication for years are having trouble accessing this medication. Physicians who are prescribing these medications to people who don't necessarily need it, resulting in, a decrease in the supply for the people who do need it. I know that not all doctors are doing this, but there's probably some that do that. And I would say you need to take a look at yourself in the mirror. And, the other issue I see with the increased use of Ozempic for people who are just trying to lose that little bit of extra weight, it just speaks to this kind of viewpoint that unfortunately we as a society seem to have, that our bodies, and I think in particular women's bodies, but certainly everyone's bodies as well, we view our bodies as like a trend. Right now it's in to look thin, but a few years ago it was trendy to look voluptuous. But back in the 90s, it was also very in to look very skinny. I just think that we all need to learn to appreciate our bodies more and be kinder to our bodies, and maybe even just learn to love ourselves a little more.
Very well said, Liz. Thank you. We have more powerful tools than ever before with drugs such as Ozempic. And, they're used for treating medical ailments, and they can potentially be used for improving our appearance and our self-esteem. But we need to apply these tools sparingly and with caution and with proper allocation around the world. If you want to see more of Dr. Grand in future videos, let us know in the comments below. Don't forget to subscribe to the channel and turn on all notifications.